Hi, I'm Elle Gunderson, a doctoral student of occupational therapy at Touro University, Nevada, and a mother of 4. I have spent the last year studying postpartum post-traumatic stress disorder, also called PP-PTSD. Between 1 month and 1 year after childbirth, 16.8% of new mothers present with symptoms of PP-PTSD, and 4% to 6.3% of women develop it. A combination of risk factors prior to and just after birth are capable of predicting this diagnosis before it develops, and preventative treatments exist which could preclude the condition altogether. However, neither risk factor identification nor prevention is currently universal in practice. The American Psychiatric Association defines PP-PTSD as a development of a certain cluster of intrusive and distressing symptoms over a prolonged period of time following a life-threatening or perceived life-threatening traumatic event, such as labor and delivery. Horsch et al. Recently published an encouraging 2017 Level 1 randomized controlled trial titled Reducing Intrusive Traumatic Memories After Emergency Caesarean Section, a Proof of Principle Randomized Controlled Trial, which took a neuroscientific approach to understanding and treating PP-PTSD. The authors describe PTSD as a condition with sensory processing pathophysiology. During traumatic events, the body takes in and processes more visual and spatial information than is typical. Large amounts of visuospatial data are stored, leading to visually rich nightmares of the event, as well as realistic and disorienting flashbacks, relegating those with the disorder to relive the traumatic event over and over again, particularly when triggers that remind the mother of the trauma arise. As the title implies, this study was completed among post-emergency cesarean section mothers and aimed to prevent the consolidation of post-traumatic stress memories to long-term memory. Horsch and his fellow researchers asked 29 mothers who had just had an unplanned C-section to play Tetris on a Game Boy within 6 hours of giving birth. They needed only to play the game for 15 minutes for significantly positive and long-lasting results compared to the 27 women who did not receive the intervention and were in the control group. Prior to the beginning of the study, each participant completed baseline data measures, including the Acute Stress Disorder Scale, ASDS. After the participants completed the baseline assessment, the participants were randomly assigned to one of 2 parallel groups at a 1-to-1 ratio using pre-prepared sealed envelopes. Participants in the intervention group were trained on how to use the Nintendo DS to play Tetris. Since prior research had demonstrated the adverse effects of video game sounds on stress responses, it was vital the sound was turned off while using the DS. Both groups continued receiving routine care. Those who played Tetris and those who had care as usual both kept a daily diary of intrusive traumatic memories related to the emergency C-section for 1 week. In the diary, the participants reported the frequency of intrusive traumatic memories and descriptions of flashbacks to labor. Per journal experiences during the first week after birth, the intervention group recorded significantly fewer intrusive traumatic memories at 1 week compared to the control group. Overall, the control group had the greatest number of women who experienced intrusive traumatic memories during the first 7 days, with the women in the control being 2 to 3 times as likely of experiencing intrusive traumatic memories compared to the experimental group on any given day. In addition to journaled memories, when researchers used the ASDS, they discovered that more women in the control group met the requirements for an acute stress disorder diagnosis compared to women in the intervention group through the first week. Also, there was a significant difference found at 1 month regarding PTSD diagnostic criteria, with 4.2% of the intervention group reaching PP-PTSD criteria versus 30.4% of the control group. The benefit of this visuospatial cognitive intervention is that it is preventative, fast, long-lasting, and extremely cost-effective. Flaws include the fact that the study was completed outside of the United States and without the participation of occupational therapists. Despite the lack of occupational therapy involvement in this research, the studied intervention is well suited to occupational therapy. Practitioners are uniquely situated to address the aforementioned risk factors through a preventative approach. Practitioners can prepare their clients for transitioning from pregnancy to birth and the postpartum period by educating mothers on the protective objective benefits of the visuospatial Tetris intervention. Occupational therapists are considered mental health care providers in many states. Thus, occupational therapy students should be educated on common mental health conditions in the postpartum period. I remain committed to improving the mental health of mothers during pregnancy and beyond. I invite other practitioners to further this important area of practice.